Hi, Alvin DeLeon here, and thank you for watching episode 14 of the 3-Minute Health Tip. Prior to the weekend, I was getting a lot of emails and text messages and Snapchat videos asking questions about children's health issues and children's conflicts. In particular, what kind of conflict can a child, a 2-year-old, be suffering from? And so one of the things that I tend to tell people now, I know for those of you that have been following me in these other videos, we're really looking at this from a new health perspective. The idea that our physical symptoms originate from an unexpected conflict shock that catch us off guard and create a distress for us, hence initiating this biological program to assist us in dealing with that conflict. For a child, some of these conflict shocks can merely be a change in routine. Anything that's out of the norm for the child. You have to go to the dentist one day, and so somebody has to come to your house and babysit your 6-month-old child. That could be a change in routine that creates a distress for that baby, causing a symptom. It could be that you go to a party and you're passing your baby around, and that's the first time people have seen your baby, and the shock for the baby of being passed around and held by strangers could be something that's causing their symptoms. And so this one particular case, it was an incident where her daughter was throwing up, and she would notice that the daughter would throw up at night, often after parties. Only when there's a big party, a gathering, she's with her cousins, everything's fine during the party. Then at night, she would have a vomiting episode or throw up. One of the things that we would look at here is what's happening in the party atmosphere that's different. What is it that her 2-year-old is experiencing as a conflict during the time that only when there's a party? And so as she thought about it, the mother realized that it's also during these parties that her daughter's always trying to get her attention. She wants her to play with her, she wants to do things, but because there's a gathering and she's got to prepare or she has other responsibilities, it's really hard for the mother to dedicate time to her daughter. She realized that perhaps that's the shock, that, normally outside of these events, her daughter gets her undivided attention, and yet when there's these parties going on and there's other people, she doesn't get quite the attention that she wants from her mom. Her ability to help her daughter see this, again, just by creating now a situation or an environment that allows her to be comfortable with not getting her mom's attention during these parties. So maybe you set aside time during a party to play with her, or you go out of your way before a party or after a party to make sure that she feels really secure and confident that you've given her the attention. And the interesting thing about this is, as we followed up with the mom, she starts to recognize this pattern, and she was able to help alleviate her child's symptoms by constantly having her with her leading up to these parties. So again, this goes to show that for a child, all it could be to create a conflict shock and symptoms is a change in routine. So I hope that is valuable for you moms out there as you apply this new health perspective to your children. Thank you again for your attention, and I'll see you at the next episode.